Ukur Yatani has absolved himself of the MES, that is the Managed Equipment Supplies Project, MES, saying the buck stops with the Ministry of Health. Treasury maintains that issues to do with the variation of the cost of the project and other reported inadequacies lies at the doorstep of the Ministry of Health.
Treasury is absolving itself of any blame in the Mismanaged Equipment Supplies Project or MES, project that was supposed to procure medical equipment worth 63 billion shillings to the counties.
These agreements that were entered in.
When Treasury CS Ukur Yatani appeared virtually before the Senate ad hoc committee probing the matter, he was hard-pressed to explain why the money each county are required to pay per year for the equipment were increased from 95 million shillings to 200 million shillings for a fixed term of 7 years.
Which is evidently over 100%. Is the Treasury aware of any new contract entered in this MES structure?
These are questions whose answers are placed with the Ministry of Health. If they have undertaken variation outside the law,
yes,
then they be dealt with as required. Because the role of Treasury is not to supervise, really not to micromanage ministries.
Have you ever raised a concern in cabinet?
If there were some omissions, if there are some procedural gaps, I said the best people to answer this is Ministry of Health. I cannot sit here and say the project has a problem.
The MES contract was initially pegged at 38 billion shillings, but later adjusted and raised to about 63 billion shillings. For a while now, governors have claimed being sidelined in the whole process of securing the MES contract, saying that they were coerced to sign an MOU to facilitate the supply of the equipment that involved the Ministry of Health and international firms.
Where the Council of Governors were forced to sign, I think that's not for me.
All counties are paying the annual 200 million shillings, despite having an equal supply of equipment, even as some counties are paying for equipment they have not yet received.
And you, as the custodian of our money, what do you have to say? Isn't this a prejudice to counties?
Maybe, Senator Tangula, with due respect, you ask the Minister of Health. Because we gave them the money, it's up to them to manage.
This comes a few days after former Attorney General Githu Muigai also accused Transport Cabinet Secretary James Macharia, who was the then Health CS, and former Health Principal Secretary Hadija Kasachon of ignoring his legal advice and signing the contract. Vincent Odur, NTV.